A very good afternoon to all of you. My topic for today is effectiveness and satisfaction of integrated modular teaching in ophthalmology for medical students. So, ophthalmology, it holds a crucial position in the global undergraduate curriculum, addressing the prevalence of visual disorders encountered by a significant portion of patients in general practice. Despite the widespread nature of visual concerns, students often lack ample exposure and enthusiasm for self-learning in this field. Conventional teaching methods may fall short in captivating students or harnessing the advantages of contemporary technology. So the integration of multimedia and innovative teaching techniques such as the flipped classroom model, team-based learning, and simulation scenarios creates a structured setting for students to hone their clinical skills and diagnostic abilities. Recognizing the practical significance of clinical skill acquisition, it becomes imperative to ensure that undergraduate medical students receive comprehensive training in the diagnosis and management of ophthalmological disorders. To address these challenges, an integrated modular approach has been introduced aiming to engage students, stimulate interest, and offer a comprehensive understanding of clinically important ophthalmological topics through varied teaching methodologies. Additionally, assessing the effectiveness of these teaching approaches is crucial for gauging their influence on student learning and contentment. So the objective was to evaluate the efficacy of various innovative teaching methods in ophthalmology education of undergraduate medical students, and also to measure the level of student satisfaction with these methods. So the patients were we included the 7th semester undergraduate medical students, and the intervention was various teaching methods. It was compared with didactic lectures, and the outcome was measured on the basis of pre and post-exam test scores. It was for 14 days duration, and it was a prospective observational study. So in a class of 100 students, they were divided into 4 groups of 25 students each of flipped classroom, case-based learning, team-based learning, and didactic lectures. So the flow chart, first the students were enrolled, and then they were randomly allocated into these 4 groups. One pre-test was done and a post-test was done. In the flipped classroom, they were given online videos, study materials. They were asked for team discussion and answer the assigned question. Then a pre-class test was taken. The faculty introduced the topic, there was a summary of the class, a question answer session, and the study material was reviewed. That was followed by a post-class test. This is an example of the notes that were shared with the students. In team-based learning, after the pre-class preparation, they had to do an individual readiness assurance test where a student was given this test, then the whole team was given. The immediate feedback and clarification was done, followed by clinical problem-solving activities. In the case-based learning, typical cases from outpatient clinic or hospital ward were demonstrated, and the students had to inquire about the medical history, their examination, and attempt the diagnosis. The teacher added to the knowledge by questioning the thought process and related clinical facts. In the didactic lectures, the study material was previewed, the students had to listen to that, and that was followed by a question and answer session. So the qualitative, quantitative data was in counts and percentage. Basically, pre and post-class test scores were used. ANOVA was used to compare the average scores, and a 5-point Likert scale was used to gauge the response. So this was it was more males as compared to the females. When we compared the mean pre-test and post-test scores in various groups, it was statistically significant in your flipped classroom, team-based learning, and in case-based learning. So these were the results of the Likert scale, where we can see that in understanding the subject, the content retention, and to create interest, flipped classroom helped better. Whereas if you can see, in practical learning, it was case-based learning which helped better. So if you could see, the flipped classroom, team-based learning, and case-based learning, they were very stimulating and effective approach. And the incorporation of this before these sessions, that serves as a powerful motivator. Unlike the traditional methods that rely on rote memorization, these are driven to understand and master relevant knowledge. So a fundamental shift is needed from the teacher-centered approach of traditional lectures to these diverse roles. So the students become organizers, they become presenters, and they become communicators. It's a student-driven, teacher-facilitated dynamic that not only empowers students, but also makes them feel valued. So every student is encouraged to contribute, and the inclusive environment, it fosters a longer attention span. However, there were some certain challenges and contextual nuances because there are some topics like glaucoma, which is very abstract content, and there is heavy emphasis on memorization. So, and the complexity of the procedures like gonioscopy. So, we could see that the flipped classroom that may be more suitable. So while group-based learning, it enhances the problem-solving skills, the